China is a country with 5,000 years of civilization. As early as in 1000 BC, we can find the early practices of sports medicine in China. Professor Hoffman, an expert of sports medicine from Germany, once pointed out that Chinese
五禽戏、八段锦
acupuncture and massage, traditional Chinese medicine, cupping, and so on were the pioneers of sports medicine in the world, even 900 years earlier than the appearance of Roman gladiator paramedics. Chinese modern sports medicine began in the late 1950s. From pudding to flourishing, especially during the Cultural Revolution, economic reform, and opening up, Chinese sport medicine has experienced twists and turns during its 60 years of growth and development, as well as economic taking off. In the autumn of 1978, along with the beginning of reform and opening up, Chinese sports medicine has grasped the historic opportunities for development. The Chinese Association of Sports Medicine was established to join the International Federation of Sports Medicine, which was approved and endorsed by Deng Xiaoping, Chen Qilian, Ji Denghui, and other national leaders. Now it was affiliated to Chinese Society of Sports Science. Since then, Chinese sport medicine entered into a track of comprehensive construction with the joint efforts and hard working of Chu Mianyu, Meng Jiyao, Yang Tianle, and other pioneers in sports medicine. Chinese sports medicine had gained rapid progress through the development of a complete system of sports medicine with the setting up of research institutions, sports medicine centers, and special hospitals for athletes in Beijing, Shanghai, and other provinces. Thus, made great contributions to the development of sports medicine in China. In 2007, Chinese Society of Sports Medicine affiliated to Chinese Medical Association was established. In 2008, the Beijing Olympic Games was held, which greatly inspired the exercises and fitness for all people in China. The Chinese sports medicine entered a new era of vigorous development. The building of key clinical specialty of sports medicine was listed at the major construction projects by the Ministration of Health. At the beginning, 5 hospitals were selected. Local sports medicine societies also established in 31 provinces and regions all over the country, and the number of arthroscopic surgeons exceeded 3,000. The professional training and academic exchanges become more frequent, and the number of surgical procedures doubled almost on a yearly basis. The advancement of sports medicine technologies has reached the international advanced level, even leading its new development in certain fields. At present, Chinese sport medicine and arthroscopic surgery has made great progress in the treatment of disorders of knee, shoulder, hip, elbow, ankle, wrist, and extra-articular regions. In the ACL reconstruction, we perform around 100,000 surgeries every year, ranked in top 2 in the world. Many new technologies, such as isometric-like reconstruction, especially artificial ligament research and application, has reached the international leading level in terms of quantity and success rate. Much experience has been accumulated with remarkable achievements in the treatment of multiple ligament injuries, the patellofemoral joint disorders, patellar instability, and double bundle reconstruction. In the treatment of shoulder disorders, we perform around 80,000 surgeries per year. We have carried out arthroscopic repair for massive rotator cuff tears, latissimus dorsi tendon transfer, superior capsular reconstruction, patch augmentation, reverse total shoulder arthroplasty, and so on. In the treatment of shoulder instability, we have carried out arthroscopic ligament repair, arthroscopic Bluestone Ladorje, home massage, and other surgical technologies. As for the ankle arthroscopic surgeries, such as anterior talofibular ligament repair, subtalar joint arthroscopy, cartilage repair, and so on, we have also kept path with the international development. In addition, Chinese sports medicine has made remarkable achievements in the treatment of cartilage lesion and application of arthroscopy in extra-articular disease. Chinese sports medicine places great importance on post-operative rehabilitation, individualized post-operative rehabilitation and follow-up system setup, which greatly improve the surgical outcome and patient satisfaction. Chinese sport medicine also provides medical backup for the national athlete teams and sports teams for all provinces and regions, which provide a solid backing for our Olympic athletes who won their brilliant achievements. In addition, Chinese sport medicine also provides the medical service for the army officers and soldiers in military bases. Chinese sport medicine also provides medical service for major sports events at home and abroad. More and more professionals of sports medicine and arthroscopic surgeons join the medical backup for sports events and served as CMO, not only to ensure our event support level, but also to demonstrate the significant impact of sports medicine among the general public. At the early beginning of Chinese sports medicine development, great attention has been provided to the education and training of medical professionals by holding regular symposiums on sports medicine and arthroscopy, live demonstration and team doctor training, such as COA Sports Medicine and Arthroscopy Session, CASM Annual Meeting, IFOSMA, and so on. In 2012, the Chinese Sports Medicine Lecturer Tour Team was set up in Xiamen, in cooperation with COA to provide physician education in more than 50 cities up to now. Medical education and training has cultivated a large number of medical professionals engaged in sports medicine and thus make tremendous contributions for the development of sports medicine in China. International Forum of Orthopedic Sports Medicine and Arthroscopy Surgery has been serving as a window for the international exchange of Chinese sports medicine. Cooperated with ISAKOS, ISAKOS, and FIMS, we have successfully held a series of 14 conferences. More than 300 world-famous experts have been invited to give talks to Chinese physicians, accumulating over 14,000 participants, holding more than 220 cadaver workshops, and trained over 4,000 Chinese surgeons. The FOSMA has truly become the cradle of Chinese sports medicine surgeons. China Shanghai has the honor to bid successfully in hosting the 11th ISAKOS for the first time. It is not only an opportunity to show our beautiful city and people, but also to demonstrate China's progress on a world stage. Chinese medical professionals are very active in academic and certificate research with at least 3,000 submitted in annual meeting of COA and CSSM. The high-quality research papers have been increased more than 60 papers per year, especially in recent 3 years. Some research has reached the world level, such as Dr. Liu Hongbin has won ORS 2016 Excellency in Basic Science Award in bone-tendon interface research, for example, of artificial ligament and multi-ligament injury. A Chinese moon network has been set as CALSG, with 140 publications, more than 20 SCI papers, and 20 patents, which will be sponsored by national funding. Chinese medical professionals are now holding many important positions in the international professional societies and serving at the editorial boards of many prestigious peer-reviewed medical journals. In addition, Chinese medical professionals have dedicated their great efforts to patient education, such as shoulder pain schools, knee pain schools, radio programs, and WeChat platform, and so on, to spread the knowledge about the prevention and control of sports-related injuries, as well as to provide free medical consultations to those sports enthusiasts and patients. Nowadays, Chinese sports medicine is advancing to the world leading age with a brand new image and spirit. Our sports medicine professionals have written a magnificent chapter for Chinese sports medicine with their brilliant wisdoms and tremendous efforts. Now, Chinese sports medicine have been blessed with new opportunities for development. Looking into the future, we should continue to strengthen the resource integration for our capacity building and team building in the field of sports medicine to consolidate the foundation of our clinical specialty through enhancing the scientific research and encouraging innovation, and to promote public fitness activities by providing more service for sports enthusiasts as well as the athletes. We are sure that the future of Chinese sports medicine will be more brilliant. Sailing through the Yangtze River to the China Sea, you will ride the winds and cleave the waves. Chinese sports medicine will continue to cherish the greater glories in cleaving through the waves.